Good day, ma'am. I am Carvin Tila. So today I'm going to recite the doffing of PPE. So first we're going to take off the PPE with the supervision of the trained observer to confirmly visually check that PPE has been removed properly. So inspect the PPE to assess for visible contamination, cuts or tears before starting to remove. So any PPE visible for contamination, we're going to use 1 to 10 bleach disinfectant or the alcohol-based hand rub. We're going to disinfect outer gloves with 1 to 10 bleach or disinfectant wipe or spray or the alcohol based hand rub. Then we're going to remove apron. Then we're going to avoid contaminating gloves by rolling the apron inside to outside. Next, we're going to inspect. Following apron removal, assess for PPE for visible contamination or cuts or tears. Next, we're going to disinfect outer gloves. So disinfect outer gloves with the alcohol-based hand rub spray. It depends on you. Then we remove boot covers. Disinfect outer glove with 1 to 10 bleach or and we're going to remove outer gloves. Remove and discard outer gloves. Do not contaminate inner gloves during removal. Next, we're going to inspect and disinfect the inner gloves. So inspect the inner gloves for visible contaminations or cuts or tears. Any defect, disinfectant gloves. Remove gloves. Do hand hygiene or bare hands. Put on clean gloves. Disinfect the glove with the 1 to 10 bleach or the alcohol-based hand rub. Next, we're going to remove the face shield. Remove the full face shield by tilting the head slightly and then grabbing the rear straps and pulling it over the head gently, allowing the face shield to fall forward and discard. Remove goggles by lifting back the strap over the head and pulling out away. Avoid touching the front surface of the face shield or goggles. And next, we're going to disinfect the inner gloves using the alcohol-based hand rub, and then remove hood. Unfasten hood. Grasp the back of the hood and carefully remove by pulling backward. So do not touch the inside of the hood. And disinfect inner gloves. It depends on you. We're going to disinfect it by 1 to 10 bleach or the alcohol-based hand rub spray. And then we're going to remove cover all and discard. Avoid contact of scrub with avoid contact scrub with surface of coverall during removal and touching only the inside of the coverall. So disinfect inner gloves with the alcohol-based hand rub spray, and then change inner gloves. Remove all discard gloves, taking care do not contaminate bare hands during removal. Perform hand hygiene or apply alcohol-based hand rub. And then we're going to remove the N95 respirator, and we're going to discard it properly, the N95 respirator. And then we're going to disinfect inner gloves, and then we're going to disinfect inner gloves with the alcohol-based hand rub spray, and then we're going to disinfect washable shoes. Sit on new clean surface and starting at the top and finishing with the sole on underside using 1 to 10 bleach disinfectant. And then we're going to disinfect and remove gloves. So disinfect the gloves with 1 to 10 bleach disinfectant wipe or spray or the alcohol-based hand rub spray. Remove on discard gloves, taking care not to contaminate the bare hands. And then we're going to reach back and place into the contaminated waste and container into high-risk site. And then perform hand hygiene with alcohol-based hand rub spray. And then we're going to inspect the scrub shower and then clean floor for PPE with 1 to 10 bleach solution after removal of complete. And then final inspection for any indication of contamination of the scrubs or disposable garments. Healthcare worker can wear dedicated washable boots or surgical scrubs in low-risk area, and healthcare workers entering high-risk area may shower at least change clothes when leaving the low-risk area. So that's for doffing of PPE. Thank you.